Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Tuesday, November 17th, 2020. Well, things continue to go up around the world and here at home. Worldwide, we saw 4.2 million new cases in the last week. We've never crossed 4 million cases in a week before. It's a huge jump there, but here in the United States, we had a week of over 1 million cases ourselves, far and away the most we've ever seen in a week. Last week, we had just crossed 10 million cases, and now we have just blown by 11 million. Also was not great here in the Commonwealth. Massachusetts saw 18,000 cases in the last week, about 6,000 more than we had the week before. Worldwide increase was about 400,000 more than we'd seen last week, and here in the United States, 200,000 more cases this week than the week prior. In terms of deaths, also some sharp increases there, with 65,000 deaths worldwide in the last week, which is about 12,000 more than the week before. United States, we saw about 8,000, which is another 1,000 gain over the previous week. And here in Massachusetts, we saw 177 people die from COVID-19, which is about 37 more than it was the week before. So that is a significant jump for us. Looking at the graphs, everything continues to go up across the board there. We reached new highs in cases for the weekend, with our highest days ever for the pandemic being November 13th, 14th, 12th, 16th, and 11th in that order. So that is quite the skyrocketing numbers there. Hospitalizations are also reaching new records, having blown past the sort of 60,000 upper limit set by the first two spikes, and deaths are also on the rise. So just looking at how these things are going up right now, our testing has steadily increased and is continuing to increase, but the cases in the last 2 months or so have increased at a much faster level than them, a much faster rate anyway. As you can see the arcs here, how our testing capacity has increased in a linear fashion there, but the last couple of weeks, our case counts have gone up in an exponential pattern. And that spread can be driven by the Midwest. This is looking at the regions of the United States as defined by the US Census by number of cases per million people per day. Midwest is far and away the most, but if you look down at the other ones there, every other region has passed its original highest point. So the South and the West have passed their summer spikes, and here in the Northeast, we have passed our actual spring totals there. Now, again, with the Northeast, that's a little bit deceptive because at that point, if we look back at the previous slide, you will see our testing capacity was pretty low then. So there was largely a lot of cases we were missing out on there or not catching. Whereas in the summer, we had a much bigger picture of what we were actually faced with. That said, it's still not good. When we look at these broken across the states, this is just yesterday's case counts by state. We've got several states over 500,000 new cases per day, and just a lot of very high numbers in low populated states. We've got just huge numbers coming in there. And now this is just 1 day snapshot of new cases, so that can always wiggle around here. But so in the next slide, let's take a look at where it really gets serious when we look at hospitalizations. Now this is hospitalizations per million people, so this gives us a better idea of how bad it is in any given area, because obviously 30 hospitalizations in a small rural area is going to be a lot more than it would in, say, a major city. But so when we talk about hospitalizations per million people, we get a much better look, and we see this band in the Midwest there in black, where there's over 400 people in hospitals per million people in the area, and especially in places like the Dakotas there, where there's over 500 people in hospitals per million people in the population. That's huge. Those places do not have a very big healthcare infrastructure. You know, we look over there, you know, Illinois, which still has that many, but has a much larger population. That means there's a lot more people there, but they do also have that, you know, like Chicago hospital infrastructure, but that's still huge for them too. It's just, you know, not good in any of those places. As it continues to rise, we just continue to deplete our hospital resources, the stamina of our healthcare staff. It's going to get worse and worse. In terms of how hospitalizations are doing in the course of the pandemic there, so this line shows New York, New Jersey, which were, of course, the heaviest hit in the beginning of the pandemic, and South Dakota, which is the hardest hit right now in terms of hospitalizations. Now, this line across the middle is the highest it ever got during the summer spike, which was Arizona. So as you can see, those states by population are much worse off in terms of hospitalizations than any state was during the summer peaks. And we're not where we were in New York City, in New Jersey during those original days in April, but they're kind of trending that way. You can also see they've actually passed most other states, with other New England states that were in here, in this part there, but they've kind of blown past that. And as you can see, everything here is on the rise. I know it's kind of a tangle of spaghetti there for the states that are not highlighted, but you can tell that this is generally things are higher than they were in the early fall and late summer. And of course, then the final thing that lags behind hospitalizations is deaths. And you can see where we are in terms of deaths right now. And we are at roughly the same point. The line here is the 7-day average, whereas the bars are the individual daily counts. We are basically at the point where we were at the worst part of the summer spike for deaths. However, there's a couple of things to bear in mind with that. First of all, the summer spike was largely the South and West. And you can see here in these regional death counts what those looked like. But now we can see just about everything is trending up there, so it's more broadly spread. No one place is at a peak except for the Midwest, of course, but those all combined together equal out to roughly where we were in the middle of the summer. And also, it's important to know that that peak in the summer came after cases were already trending down. Hospitalizations lag behind new cases and deaths lag behind hospitalizations. So looking at this chart with the new cases in red and the deaths in gray, now obviously these are in two different scales on different sides of the chart there. But if you look at the pattern there where the arcs turn relative to time, the cases peaked here and then went down, and a couple of weeks later, the deaths peaked here and went down. But if you look at where we are over here, we are still trending up here. So this isn't going to hit its highest points for a couple of weeks. And there are people who are just getting infected now who are going to die from the virus in several weeks from now. And remember what I said about the highest case numbers ever, how yesterday, Monday, was the fourth highest day ever in the pandemic. As we know from what we've seen in the past, Monday is typically the lightest day of the week. Now these numbers are a little old, these percentages, just a little bit into November, but generally this pattern has held up. We tend to see our highest case counts on Friday and Saturday. So we should just really be expecting to see some new highs towards the end of this week, when we'll probably also be passing 250,000 deaths in the United States. So on that cheery note, let's move on to developments, because there is something good to talk about today after we get through, of course, the broken records for case counts, hospitalizations, etc. I have not taken this bullet point off the slide for several weeks at this point. Also important to note is that several states are reimposing lockdowns in various measures. Michigan, Oregon, Washington, North Dakota, New Mexico, California, the Navajo Nation, a lot of places are doing different measures, but it's all very piecemeal right now. Each state is doing its own policies. Some are focusing on specific types of businesses. Some are issuing stay-at-home orders or curfews. But a lot of governors are moving to impose restrictions to try to curb the runaway spread we're experiencing right now. And we'll see how that works out. It's usually about 2 weeks to really see the effects of these policies, unfortunately. So if something works well, we'll still see that uptick for a little while, and it won't seem to be working for a bit. If something doesn't work, we won't know that for 2 weeks, and we'll have been doing a policy that wasn't actually helping for a little while. So that's the tricky thing with these, especially with Thanksgiving happening next week, and a lot of people still plan to travel or have large gatherings, which may set off even more spread. But let's get to the good news this week, which is last week, Pfizer sent out its early vaccine data. This week, Moderna did the same. If you may remember, Pfizer's vaccine was found to be roughly 90% effective in early data. Moderna's is 94.5% effective. And in perspective, that is more effective than a chickenpox vaccine. That is within 0.5% of the effectiveness of the smallpox vaccine, and there's no more smallpox. So that's very exciting. Of course, these are all still early data. We don't want to get ourselves worked up too much about this because as we get the full results, these numbers may come down a little bit. But this is very positive news. There is some hope on the horizon, although it is still going to be a way off. Moderna expects that they can produce enough doses for 10 million people by the end of the year, and Pfizer says about 25 million people. That's not really a lot given the size of our population alone, let alone the world. Both are two-step vaccines as well, so person needs to get vaccinated and then several weeks later come back in for a second dose for full effectiveness. But again, this is us working towards that point where we can get a vaccine deployed that will help us defeat the pandemic. Also promising with both vaccines is the side effects have not shown to be very serious, and when they crop up, they things like fever, fatigue, sore joints, muscles, nothing really unexpected or not worth the trade-off. We still don't know, however, if the vaccines will actually prevent infection or just make it less serious. If someone who has the vaccine could get the virus and be asymptomatic and still spread it, which would be, of course, be very disappointing because it wouldn't curb spread, even though it would protect individuals. We do know that the Moderna vaccine, at least, will or seems to prevent serious cases. The data they released showed about 95 infections in the test group, with 90 of those being in the placebo group. Only 5 people who received the vaccine got infections, and none of those got serious infections, while 11 of the people in the placebo group who got a dummy vaccine that was ineffective got serious COVID infections, which is also just shows that what exactly the people who volunteer for these trials are risking and how important it is the sacrifices they're making. But another important thing about the Moderna vaccine is it is a lot more shelf stable than the Pfizer vaccine, which both of them need to be chilled very significantly to stick around. But well, the Pfizer vaccine wants to be stored at -94 degrees Fahrenheit. The Moderna vaccine only needs -4 degrees Fahrenheit, which is a huge difference there for just the infrastructure we need to deploy these. Also, they reported that the Moderna vaccine can last for 12 hours at room temperature or 30 days in a regular refrigerator, which is huge for the implications for actually distributing the vaccine. Because it can be difficult to get the kind of refrigeration needed to deploy these things and keep effective. So if you can keep them in a regular refrigerator, that makes a big difference. That said, the Pfizer vaccine is still going to be useful and can still be deployed with just some creative thinking. They were able to deploy Ebola vaccines in sub-Saharan Africa that had a similar need for refrigeration, and they were able to do it. So that's something we can definitely do here if we just put our minds to it. Looking at vaccines as a whole, still more things coming in the pipeline. One more vaccine project started large-scale efficacy tests. Another one jumped into safety trials. So we are going to see a lot of vaccines at some point in the future, and also just a lot of technology developed from this for future diseases, and the implications for all the stuff we've learned in the last year is going to hopefully really jump us forward in terms of medical science in the years to come. So a lot of positive things in otherwise a pretty dark time. And you can find the sources for the numbers in the usual places. The charts all come from the COVID tracking project. New York Times has a counter that I like to use for the daily case counts, and mass.gov, of course, has Massachusetts' own information. And for more for the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.